All right. Hi, Dr. Eisenheim. Welcome to the Genetic Genius podcast. I'm so excited to have you today on the show. Welcome.
Thank you. Glad to be here.
Yay. So first of all, I'd love for you to just introduce yourself to the audience, to the listeners, and just tell us a little bit about who you are, your impact on the planet, your passions, so we can get to know you before we dive right into the show.
Okay. So I'm a naturopathic doctor and I'm also an herbalist, and I typically practice in Greenfield, Massachusetts, so doing more telemedicine these days. And I focus my practice on helping people to heal and transform from Lyme disease, chronic digestive issues, and autoimmune disease as well. And I'm really passionate about cooking and nutrition and herbalism and just really education, teaching people about how to take care of themselves.
That's great.
Yeah.
I love that. It sounds, I know from knowing you for so many years, your passion around nutrition and, plants and all of that great stuff that I can't imagine your patients are just so happy to soak it in.
Yeah. And it makes it more fun and interesting. And, then you can be empowered to and be part of the process.
Right, exactly. Empowering everyone to take charge of their health, right?
Yep.
So today I'd love for our focus to be around your expertise in Lyme. So let's just dive right in. And can you first tell our listeners about what is Lyme disease anyway?
Yeah, sure. So Lyme disease is a infectious disease that is transmitted by ticks. And there's also a term called tick-borne illness, which kind of encompasses a more broader term of what Lyme disease is, because Lyme disease, when it was originally, founded discovered, there was one bacteria that was associated with it, which is the Borrelia burgdorferi, which is the spirochete that most people are familiar with, that causes a lot of the classical Lyme disease symptoms. But there's also a lot of other bacteria and even viruses that you can contract from ticks that people aren't always so aware of. And so, Lyme disease can be kind of in an acute form and chronic form, and there's different stages of it, typically like 3 or 4 stages. And usually we get it from ticks. And, anybody can get it living in a city, country. It is typically more associated with people who are going outside a lot, like hiking and biking and canoeing, outdoor activities. But I have had patients who've just been out in their garden and gotten tick bites, depending on where you live. So.
Right. Yeah. Here in Asheville, it's not as common in our region, but we have them here. And especially, most of my patients will get it from their dogs. So they'll be, outside and they're walking their dogs, and their dogs will bring the ticks home with them. And then they're like, oh my gosh, how did I get this tick? I wasn't even in the woods.
Yeah, that's a really common, we call like a vector, is animals, so like you have cats or dogs that are, going outside. They get into the leaf litter, because that's where the ticks like to hang out. It's kind of in the leaves, the leaf litters, and more like dark, shady, wooded areas. They do also live in fields and open spaces too, but not as prevalent, not as much. And so, that's a big way that anybody who has dogs or your cats that go outside, I usually always suggest starting in the springtime to, just do a tick check every day. A couple of minutes can really save your life. So.
Oh, great. Good. Well, we're going to talk more about that. I want to hear about your prevention ideas and tick checking. But first, I'd also like to hear about what are some of the myth busters, because a lot of people have, kind of like misconceptions around Lyme. And if you could talk a little bit about that.
Yeah, there's a lot of myths, definitely. I think one big myth is that, you have to have, there's sort of the classical, Lyme, like triad, and you have 3 or 4 different symptoms where it's like, fever and joint pain and a bullseye rash and maybe extreme fatigue. And what we know is from the ILADS research, which is the International Lyme and Associated Disease Society, is that really only 30% of people get joint swelling, and I think 30 to 60% of people notice a rash of any kind. And, that's another myth, is you don't have to have a bullseye rash. You can have, I've seen lots of bullseye rashes, like more than one. I've seen just a big red patch, and just, see nothing. So it can be all kinds of rashes. And even things that look like eczema and other types of inflammatory skin conditions. And then another big myth is that you have to have seen a tick to have had Lyme disease. But again, with the ILADS research, we know that only 50% of people who have, and these are people that have been diagnosed with Lyme disease, have noticed that there was a tick bite. And they found that they didn't find a tick on them. 50% did, and 50% didn't.
Right. So they could have been bit and then they didn't realize it. Is that what you're saying?
Exactly.
Yeah.
Yep. Yeah, especially because a lot of the ticks, especially in the springtime, are really small. They can be like the size of a poppy seed, and if you're not, your eyes aren't trained really well, or you live by yourself and you don't have great vision, you might not catch all of them. So.
Yeah, that is super tiny.
Yes.
Yeah. And they have a different name when they're that size, right? They nymphs, is that what they're called?
Yes.
Yeah. And so that's when they're is there a stage of their life when they're more active, so to speak, when you're more susceptible to the Lyme disease?
That's kind of like a myth too. I mean, you can contract Lyme or any of the other pathogens that the tick is carrying at really any stage of the cycle and of the development of the Lyme. So they start off as babies and nymphs, and there's a myth that you can't get Lyme from a baby nymph tick, and you actually can. You can still get Lyme transmission. You can get the transmission from an adult as well, and I would say like the higher rates of transmission are happening more in the spring and in the fall, when they're basically when they're mating and reproducing.
Right, when they're super active.
Yeah, when they're more active. Exactly.
That makes total sense.
Yeah, and there's so there's another myth, dog tick. There's difference between the deer ticks and the dog ticks. And some people think, oh, you can't get Lyme at all from a deer tick, and they do carry. What I've seen, because I often, if any of my patients do get a tick bite and they find the tick on them, I always have them send it into a lab at one of the universities around here to get the ticks tested, because they're more reliable. It's more reliable to test the tick than to test human blood for Lyme and the other co-infections. So what I know from those reports is that you can still get, it's usually just Lyme. It's usually just one bacteria, not like a whole lot of co-infections as in with a deer tick, but you still can get Lyme from a dog tick. So that's kind of a myth as well.
Well, it sounds like there's a lot of different myths out there. So it's good to have, to have the true information. So it's great to have you on talking about it for sure. So it sounds like there's a lot of different kind of variables that go into Lyme. So what are some, and from my perspective and from other patients, I've heard, lots of different symptoms. So what are like the classic kind of symptoms? And then let's talk about, some other symptoms that people might not be aware of that could be showing up as Lyme.
Yeah, that's a great question, because we tend to call Lyme the great mimicker. So in an acute phase, meaning like you just got bit, in the last couple of days, last couple of weeks, usually the symptoms are pretty extreme and are more obvious, but they can be anything from the fever. You can have the fever, you can have the joint pains, but you can have migrating pains anywhere in the body. So it could show up just as like a headache, for example, or migraine. And yeah, so fever, pains. I've seen even in the acute stages, sort of sudden anything that's like a sudden and extreme symptom. And it's like, there's some flu-like symptoms along with it, like some, being really exhausted and being really achy and just like lying in the bed, not getting up, that kind of thing. Plus, one or two other things, like you can get a rash of any kind. That is typical. But I've seen sudden extreme mood changes in people, especially in children. So, if you notice anything like that, that can definitely be a sign that there was a tick bite or some Lyme disease going on. Sudden extreme pains, sudden and extreme change in digestion, which is usually more towards diarrhea, but it can be it could be like a stomach pain, So it can be it can be all over the place for sure.
Mm-hmm.
And then also there can be with the mood stuff, sometimes can be just extreme anxiety or panic attacks that, where somebody who doesn't normally tend to have those kind of things. And then what I've seen is, especially in patients who have a compromised immune system, like with an autoimmune disorder, they might just get some of their typical symptoms. So let's say someone has chronic migraines and
Mm-hmm.
burning pain in their feet or something like that. It might be that when they get a tick bite, they don't get some of the other things that I mentioned, but their typical symptoms just all of a sudden spike up and get a lot worse.
Oh, interesting. Yeah,
Yeah.
that seems like that would be a little bit challenging to identify if you
Yes.
if you already had an autoimmune disease or other chronic immune condition, and then you're like, oh, I might be having a flare up.
Right.
Mm-hmm.
Yep. Yeah, that's why it's always good to investigate if there was a tick bite, or
Yeah.
even if it's like, well, when you're out hiking, or someone who lives in the country is out a
Mm-hmm.
lot, or has a dog, like you were saying.
Right.
So
Yeah.
it's always good to investigate that. But yeah, because Lyme is called the great mimicker, you really can have the symptoms can really be anything. I've seen and heard stories of, like I said, like extreme anxiety and panic attacks, and maybe just that with like a fever and pains. A lot of burning pains, like searing joint
Mm-hmm.
pains, are very common. A lot of neurological type issues like
Mm.
tics and twitches.
Yeah.
Um, yeah, because for some people it can get into the brain right away. Often that's in the later
Right.
stages, but sometimes
Mm-hmm.
people go right into that if they for different reasons, like if they have a family history related to that or underlying conditions. Sometimes it jumps to that right away.
Wow.
And
Yeah.
yeah, I've also seen things like shortness of breath,
Mm-hmm.
things that look kind of like a pneumonia type thing, or
Right.
some respiratory condition. So yeah, it can get complicated. That's why it's good to work with a Lyme literate MD, or at least some primary care doctors and urgent care doctors are getting better about testing and
Mm-hmm.
including the tick pathogen panels at the emergency room when people have like really weird symptoms
Right.
and
Yeah.
are testing negative for flu, testing negative for COVID. It's always something to think about. So
Right. Yeah. Something to keep in mind to tell your physician about, sounds like,
yeah,
to bring it up
yeah.
to them. Yeah. And so what about, so those sound like a lot of the like non-typical, like you said, the big mimicker. Are there kind of symptoms that, not to put Lyme into a box, but that are more typical, like I think you said with the joint pain, but what about if someone is more in uh, more chronic state and they haven't been diagnosed with Lyme and they just can't seem to figure out what's going on, which is very common, and
Yeah.
so have you seen, with your expertise, seen any like common kind of symptoms within that group of, the unknowns? Does that make sense?
Yeah. It's kind of hard. Well, I'm thinking about it. It's kind of hard to group them all together because it can be so many different things.
Mm-hmm.
But like I said, I do see, well, what is kind of typical is migrating pains. So pains that don't just stay in one area, and
Mm-hmm.
that could be muscle or joint pains, low grade fevers or fevers of any kind,
Mm-hmm.
symptoms that kind of come and go. And I would say anxiety or depression, kind of one of those ends are usually there.
Something in the
Like
nervous system.
mood changes. Yeah.
Mm-hmm.
Hmm.
Interesting.
Yeah. Yeah. Lyme really can attack the nervous system. So that's why you can
Mm-hmm.
get a lot of these like sort of weird burning neurological symptoms.
Yeah.
And kind of the thing why it's hard to say like group it all together like that is
Right.
because what happens with the chronic Lyme is there's so much inflammation, and the bacteria and the viruses tend to just start attacking like where there already were weaknesses in the
Mm.
systems and the organs. So that's why it's kind of hard just to say like to pin it down. But let's
Right.
say at least like the migrating pains, some mood issues there, and there can be fevers, night sweats, skin changes.
Yeah, lots of varied symptoms, it sounds like.
Yes.
So you have to make sure you have a good doctor on your team to be able to ask the right questions, it sounds like.
Yes.
Yes.
Yeah.
So it sounds like if you're having some of these kind of, varied symptoms and you're talking to your naturopathic physician or MD, what's the diagnosis part of the process? What are kind of some of the labs so that our listeners can know the process if they're thinking about going and getting tested, if they're having some of these strange kind of symptoms?
Yeah. Yeah. So unfortunately, it's kind of all over the place for diagnosis of Lyme. If you're talking about something more acute, like it's easier if you found, it's really easy. Well, it should be easier if you found a tick,
Right.
it was on you, and then you're having symptoms. Because in conventional medicine, they'll, basically, you'll get the medicine that you need if you kind of fit all the boxes nicely. So, and there's a little bit of difference with like diagnosing acute versus sort of chronic Lyme,
Mm-hmm.
and there's different basically camps and ways of thinking about it.
Mm-hmm.
So, but with like a more acute situation where you just start having flu-like symptoms all of a sudden, or you got a tick bite, or you don't, but you suspect that you have it. One of the issues is, so one of the tests that's used conventionally, and also, well, I guess I'll say conventionally versus like a Lyme literate, whether it's MD or ND or
Right.
a nurse practitioner or whoever.
Mm-hmm. That
There's
makes
a little
sense.
bit of a difference, yeah, between the diagnosis in the Lyme literate world and the non-Lyme literate world.
Okay.
And so in the they both use a Western blot, which is basically testing different bands of proteins for your antibodies, right? And the antibodies are what we produce when we make an infection. The problem is with Lyme is that you don't make the antibodies until 4 to 6 weeks after you start to get sick. And so you see the problem with that is you really want to get the antibiotics like way before that. You want to take the antibiotics within 72 hours of any symptoms. So before, without having any chronic repercussions really. So, so with the Western blot is one of the tests that's used. And then in the non-Lyme literate world, they'll often do some other tests like a PCR and a general Lyme antibody test. And often those are negative. And so it can be, I have one patient I'm working with right now where her primary care doctor is not able to do the Western blot for her, and they see that as more like a specialty medicine. Like she might have to go to an infectious disease doctor or somebody else to get help with that. So, so there's the Western blot, and then there's a difference. Excuse me. There's a difference between the Lyme literate Western blot and the non-Lyme literate Western blot. So there's a test called a company called IGeneX, and I'm not, I don't get any money for naming them, but they're kind of like the main one, and they're in California. And so they have a Western blot that is just more extensive. And so we find that's the one that a Lyme literate doctor would use. And that's something that's usually, cash price, and not something that
the insurance is going to cover.
Sometimes they'll reimburse.
Right.
But a lot, that you have to pay up front for that. And so that is a better test. But with the diagnosis, and then there's different ways to diagnose, like you kind of look at the different antibodies and, and go from there and figure out like if this looks like more acute or more chronic case.
Depending on the antibodies.
Yeah, depending on the antibodies. So there's that one test, and then there's a lot of other labs like medical diagnostics, medical MDL, medical diagnostic labs, and some other ones I'm not remembering right now that will test for the co-infections. A lot of times you can use like a conventional lab like Quest or something like that for some of the co-infections. But IGeneX also does the co-infections, and you can get like a whole panel, and they have a panel that's like, neurological Lyme panel, for example.
Oh, okay.
Yeah, but there's a lot of false negatives with the Western blot. And there's like maybe 9 or 10 different reasons why you might not be showing the antibodies when you have chronic situation. One is that they could be all in the tissues, attaching to different tissues and doing their work, and not in the blood anymore. And when you've been sick for a while, you may not be producing antibodies. Those are a couple of the reasons, but really it's kind of can be better to use. I find this better just to use like the clinical picture and the story
Right. Exactly.
kind of diagnose. And also sometimes it's just by testing other things and
Ruling out.
ruling out other things and making sure people are, don't have diabetes or other autoimmune diseases that could be actually the cause of the problem, because
Right.
it's not always Lyme all the time.
Right. Yeah. It's not always exactly.
Yeah. And sometimes the Lyme triggers an autoimmune disease, like seeing that with like rheumatoid arthritis and some other things. So
flare up of other diseases.
yeah.
Mm-hmm.
Yeah.
And it's interesting that you were saying that so say for instance, you're out hiking and you get bit by a tick, but you might not know, which is common for people. They might not notice it for a couple of days, then they might have some symptoms. But then if they get their antibodies run, it might not show up in their system
Right.
for another 4 to 6 weeks. So then what's the kind of recommendation in that time frame? Let's say, Susie calls you up and says, Dr. Eisenheim, I think I was bit by a tick. I'm having, I see some evidence, where some people, you can't always find a tick, right?
Right.
And so maybe they're just having some symptoms, a little rash or something. What's your go-to kind of there? What do you say, like, okay, Susie, what do you do now?
Yeah, definitely. So it's kind of different for every person. It's a little bit different for every person. Like if I would recommend them to like call their primary care and, get on the antibiotics, doxycycline is usually what's used, because I don't have prescribing rights in Massachusetts, but I did work as a primary care doctor in Vermont where we have full prescription rights. So I know all the guidelines and I'm familiar with the guidelines.
Yes.
And so, basically if the way that we would practice in the clinic that I worked at, and I still, follow those guidelines with my patients and what I coach them on and recommend them on, is that, generally we can start with like, if you did, you got a tick bite.
Right. Let's start there.
Yeah.
You found the tick.
Right. So usually I recommend sending in the tick for testing, because again, that's usually more reliable than testing the blood. And
you use to a university, you said they send.
Yeah. Here there's the University of Massachusetts has it's called like it's tickreport.com. And you basically, the tick doesn't have to be alive. Because they're just testing the DNA. And so you basically send the tick, you can like freeze it and you send it in a little envelope to the lab, and then it comes back with a report about a couple days to a week later, depending on how busy they are, with like a full description of all the different things it was carrying. Right. And so if you don't have symptoms, I usually suggest starting on a herbal and homeopathic protocol right away. And I use a Stephen Buhner's protocol mostly for the herbal protocol, and that has 3 or 4 different herbs in it. And I usually have people stay on that for 6 months or so, just as a preventative, just to make sure there's nothing developing, because it can kind of go dormant and it can seem like there's nothing happening, and then you can have symptoms again.
So when you say dormant, you mean, can you explain to our listeners what that means? Does that mean it's hiding? Where is it hiding? Is it hiding in the tissues, hiding in the cell?
Yeah. So Lyme in general tends to hide out in connective tissues, like joints and knees, even in places like in the heart and eyes, places like that. And so sometimes when there's like, you have the initial if you have initial symptoms and it seems like it's and you didn't get treatment, like let's say you didn't get the antibiotics or you didn't do any herbs or anything like that, it can seem like, you treated it and it went away, or you didn't treat it and it went away. But then sometimes you can have other symptoms that come back later in a different cycle.
To bite you.
Yeah. But I was trying to think if I had finished my other thought, which was so what to do, generally it's like a way to start on the herbal and homeopathic protocol. Right. While we're waiting for the tick results to come back, and while we're, if you're not having any symptoms, if you do start having symptoms, you want to call go to urgent care or call your primary care doctor and get on the doxycycline, which is the main antibiotic that's used for Lyme. If you're allergic to that class, they might give you something else. Right. But you want to get on that like pronto, within 72 hours of any symptoms starting. And usually it's usually pretty obvious though. And, and that's why I have people call me and we'll do, quick acute consults just to
right.
be like, okay, does it make sense? Because the other day I had somebody where it wasn't super clear, like they got a tick bite and it was like very embedded, meaning it, like the tick had fed for a while, a couple of days maybe. And he went and sent the tick in, and he had some really mild symptoms, and it was like, oh, a little tingly, a little headachy. And I was like, well, usually it's like really obvious, like, oh, like extreme headache, extreme back pain, nausea, like on the floor, like can't do anything.
Right.
Not just very mild symptoms. So, and then his tick report came back as completely negative, which is very rare around here. So we were happy about that, but we already started on the herbal and homeopathic protocol. And usually like the recommendation by ILAS, which again is where the kind of the Lyme Literate Society for practitioners. It's International Lyme and Associated Disease Society. They recommend 6 weeks of doxycycline. And sometimes you'll get that through primary care, and sometimes you won't. So we just kind of do the best we can in those situations, and then also support the gut health.
Right. Yeah. Totally.
Time, take probiotics, and I still have people take the herbs when they're taking the antibiotics and some other supplements as well, because you want to really, if you're doing 6 weeks of antibiotics, or even 4 weeks, that's a really long time. And so you
very long time.
Support your organs and support things. And the herbs help to kind of prevent a lot of side effects with the antibiotics, and the probiotics help, maintain the gut health. Like we never had any, there's a pathogen called a bacteria called C. difficile, which causes like really bad, nasty bacteria, and a lot of people that are on doxycycline for that long. But in our clinic in Brattleboro, Vermont, we never had that issue, because we're always putting, making sure people are taking probiotics while they're taking antibiotics. And you want to space it out. You don't want to take it exactly at the same time, but you don't have to wait until you're 6 weeks to take probiotics.
Don't do that. Your gut will not be happy.
I just have to grab my forget to grab my charger here.
Oh yeah, no problem.
It's just right here. Okay.
Perfect. Yeah, no problem. Got to keep the juice going to the phone. Yes. Or the computer. Okay. Yeah. So you mentioned stages earlier. So can you talk a little bit more about the stages? How many stages are there, and what's the length of time that you could go in being in some of those stages?
Yeah. There's usually about like 3 or 4 different stages, depending on like there's some different perspectives on that. Like Chinese medicine has one way of looking at it, and then you'll see different things if you look online. And so I kind of like to think of it as like, the acute stage, intermediate, and then kind of more like long term or late stage. Yeah. So, and somebody can jump right away to the late stage. It's not like other illnesses where there's like a really set time period for each one. But the beginning one is like kind of what we call like more superficial, meaning not that it's not like important, but that it's more like on the surface layers of the body, and it's having, entered into like the nerve cells, for example, which are really deep, or the brain. So the first stage is like, acute fever, skin, issues. We see the rashes and things like that. Maybe some heart palpitations, some, there can be, like I said, like some of the anxiety, some of the pain starting at that level, some fatigue. But it's like, it's not quite so deep yet,
Right.
Then, for some people that can last for, that doesn't last like super long. I haven't really seen that go on for months at a time, maybe 2 months at the most, 2 or 3 months at the most. But yeah, some of the homeopathic remedies and herbs actually help so that help the infection to stay at a more superficial skin layer and not get right into the blood right away. But then the second level is kind of getting into some of the deeper tissues and organs, and you start to get like more intensity with like a fatigue or brain fog. maybe starting to see some sleep issues.
Mm-hmm.
You could still have like some of the things from the first stage, but it's kind of like things are just getting more deeper,
Right.
in a way. And there's usually like starting to see more of that like migrating pains. You could start to see like anemia kind of show up at that stage.
Interesting.
Yeah. Different changes kind of in the blood. Some of the organs can start to get affected because there's a lot of inflammation going on. And then that's kind of like the intermediate stage. And the first two stages, the acute and the intermediate, are where it's easier to work with people and treat people.
Right.
And then the later stages are kind of where it's like more in the brain and in the nervous system, and more neurological symptoms, like burning, more kind of even burning pains, more intense insomnia, and like kind of some of the more intense mood things, mood changes, even things like OCD.
Wow.
Yeah. And bipolar, anything kind of that we would consider maybe like a mental health diagnosis at that point, we kind of fit into the later stages of things. Trying to think what else, but that's kind of mostly it. It's just like, and everything kind of gets worse at that stage, so just more. Right. So what we see with some of the sleep issues is it's not only insomnia, not only trouble falling asleep, but sometimes people also will just sleep like all the time, or kind of have different sleep patterns where they're up all night and then they don't go to bed until like 4 a.m. So kind of like disordered sleep.
Things. It's so interesting. It's just so, Lyme is such a multi-system disease, how it can just wreak havoc in like all the different aspects. It's just so fascinating to me, to that one little tiny, critter can then do so much harm in the system. Let's talk a little bit about the co-infections, because I know that's a lot of people don't understand what that is all about. And there's so many different co-infections. So can you talk about like, what is a co-infection? And then what are some of the common co-infections? And then do you have to have different rounds of different antibiotics for different co-infections and treatment?
Yeah, sure. So some of the more common co-infections that we know about. So co-infection is kind of what it sounds like. It's like you have the main one, you have the main Borrelia spirochete, which is the main thing that causes Lyme, but then you have an additional pathogen is what we'll call it. So a virus or bacteria that you can pick up from the tick. And so some of those are like the Babesia, Anaplasmosis, Bartonella, Mycoplasma, which Mycoplasma can cause a pneumonia, but this is not one that you get from someone else, like respiratory. Walking around. It's not from getting it from another person coughing. It's from the tick itself. And there's a lot of viruses too that it's interesting. I just saw the tick report and I was like, oh yeah, they have the Heartland virus on there and some other ones that I'm just starting to learn about, because really not a lot of, even in like the Lyme world, not everyone's testing for all the viruses. And there's viruses that you can get from the tick, and then there's also viruses chronic viruses like Epstein-Barr virus, or ones like that you don't get from a tick, but you get because you're just immune compromised, and you normally wouldn't get that causes mono, for example. So those are the co-infections, and they some of them are covered by doxycycline, like the Anaplasma is, I believe the Bartonella is, but things like the Babesia is more like a parasite. I mean, you could call all of Lyme a parasite, but it's more like malaria. Right. And so, unfortunately, the pharmaceuticals for that are really hard for most people to tolerate, and cause a lot of like nausea. And honestly, I haven't really prescribed that I think I prescribed it once for somebody, so I don't remember the name of the medication.
Is that what it's called? Malarone?
Yeah, it might be. Yeah. But I tend to use more of things like artemisinin, which we know worldwide is used for things like malaria. So a lot of the way that we treat the Lyme and the co-infections is from information from, places like Asia, where they're dealing with a lot more infectious diseases than we are a lot of the time. And so we know from the research of what works for, things that are similar. It's not exactly malaria, but it's similar enough that we find the things like artemisinin, which comes from sweet Annie, which is a plant similar to wormwood in the Artemisia family. And so it's basically like a constituent of that plant. So yeah, there's different things that work for, and there's some other formulas too that are a little bit harder to find, something called like a CSA formula. And there's like a lot of different herbs, like kind of rare ones. Like there's one called, sometimes for a lot of the co-infections, I'll use hawthorn berry because some of them affect the heart and heart rhythms. And I'll use things like different medicinal mushrooms, like reishi or cordyceps that we know and work for things like Bartonella and Anaplasma. So we usually kind of some of these things work better with using herbal remedies, and some of them work better by using the pharmaceuticals. So,
depends on the person.
And sometimes a combination of what's really needed.
And so it sounds like the co-infections are pretty varied, and it can depend on the person and their original state of health. And when it's more, I also work with people differently when things are more chronic. I'm not only doing antimicrobial therapy because usually there's a lot of damage to the organs and a lot of inflammation at that point. And it sort of doesn't matter how many herbal or pharmaceutical antibiotics or antimicrobials you're pouring down somebody. If there's a lot of inflammation, there might be a lot of scar tissue, and that medicine is just not going to get into the tissues. You have to deal with the scar tissue. And so there's different herbs and supplements and manual therapy available for that as well. And then and then also there's just things like if your whole nervous system is being attacked, you really need to, I usually kind of work with like, okay, where's the health in the body and where can we create more health? So it's a little bit of a different paradigm than even within like the Lyme literate world. And it's kind of more, focusing on how can we create, health through nutrition, creating an anti-inflammatory diet, things like that. And how can we help support the organs and the systems to function better? Because like if you kind of build health within the body, then your body's like strong enough that it's going to fight this on its own. And maybe then at that point you might want to do antimicrobials of some kind. It's so interesting that it attacks the tissues. It's just like when I think about the spirochete, I think of like drilling down. That's not what it really does, but I'm like, oh, it like embeds itself, into the tissue. It's just such a crazy little critter. Do you think that so with the COVID virus, do people that know that they have Lyme and are they possibly more susceptible to the COVID virus because of their chronic immune condition?
It's a good question. I haven't really I think there's been a lot of speculation about that, but I haven't seen any conclusions on that yet. I think I've been in touch with all of my Lyme patients and cancer patients too, like anybody that tends to have a compromised immune system, especially if there's usually what the research is showing, what I found is the folks with more of a impaired gut, where there is not a healthy gut flora.
The microbiome is off.
Where it's from lots of antibiotics that someone has been on for months and months at a time. Or whatever, or they have just, Lyme and some of the co-infections can also attack the digestive system. So usually what I'm finding is it's like, people that have sort of any chronic respiratory issues, or people that are having chronic digestive issues or acute digestive issues that they haven't quite
Right.
resolved, and we haven't worked on the gut microbiome. It's like those are the people that seem to be, getting the more severe or the more moderate cases, I guess, moderate to severe cases of the COVID, and are more at risk because we know that that's part of where the SARS virus 2 is attaching.
Into the respiratory system.
Yeah, and into the gut. So,
the gut. And and Lyme doesn't, it has a lot of factors for the GI system, but it doesn't affect the respiratory system. It's not like that's kind of not its main focus. I would actually say focus.
No, it's not its main focus, but you can have, I've seen, one kind of myth, like you were saying before, is like, it doesn't really affect like the heart that much, but I've seen kind of heart block, and there are certain heart issues and that aren't recognized because it's attacking the neurological system, but your nervous system really is what's involved in like blood pressure and
the vagus nerve.
And the signaling of the heart and the heartbeat and all of that. So if that's, and if you can have Lyme getting into any connective tissue.
Right.
So, that's why it can affect really any system and any organ. But I have seen there are some of the co-infections too that affect the lungs a little bit more than others. But it's not like the main thing.
Right. Yeah. So you have a 9-step kind of approach to Lyme recovery. Can you kind of talk our listeners through briefly through what that 9-step kind of looks like? I know that you have a lot of great expertise in different parts that you bring into that. And I'd love for the listeners to hear more of that perspective.
Yeah. So, really the first step is kind of getting someone in for a Lyme consult, whether that's, right now, not in person, but, going over the medical history and getting the clinical picture and seeing what co-infections might be there, and then doing some pathogen and imbalance testing, which again, is maybe looking for, it could be testing through someone's primary care or through a specialist. But also a lot of it's just like through the clinical history and also doing other tests for the organs, like what's going on with the kidney and the liver and all of that. And then we would have a follow-up again, and that's kind of like the first part is just like all, assessments, and sometimes that takes a while, and also looking at like what's going on with your diet, nutrition, and all of that. And the other steps are, they don't have to all be in the same specific order because again, everybody's kind of coming in with different things.
Right.
Some people have, worked a lot on their digestive health, and so maybe we don't need to work on that. But the second phase is kind of like, balancing a lot of the body systems. So, when we assess and find out what's needed, it could be that we need to work on boosting the immune system. It could be that we, for most people, we are boosting the immune system, decreasing inflammation, balancing the inflammation, and kind of repairing the organs from the damage from that. And we're optimizing digestion because our gut is like the seat of our immune system. So we need to have a healthy gut and the seat of our nervous system too. So it's like we really need to have a healthy gut
for everything.
Exactly, for everything, but especially for like recovering from anything chronic, really.
Yeah.
But especially in chronic infectious diseases. And then the recovery phase is kind of like where we're working more on like calming down the nervous system. Like again, if you're in that late stage, you could have a lot of like anxiety and agitation and food cravings and almost mania type symptoms, like along with some really intense joint pains that are burning maybe, or or sciatica type stuff. And so we need to really like calm and down and balance the nervous system to kind of come into a more balanced state with that, so that that's one of the ways we can work with bringing more health into the body. And then usually there's some kind of trauma just from either not getting treated or just being really sick. And like I mentioned before, just some of the mood changes that can happen. So there's always some kind of emotional support, emotional reset, and then eventually kind of getting to the point where there's less flare-ups, and more vitality, more relief in the body, kind of feeling you're getting your life back at that point. And this can, if we're talking about somebody in like intermediate to somebody who's been sick basically for more than 3 or 4 months. It can take up to a year to really kind of fully recover.
Yeah.
And it doesn't mean that you don't start to feel better after a couple of months of working together. There can be different things like, maybe your sleep starts to improve, maybe your digestion starts to improve, or you have less pains, or maybe, you have more energy and you can do more things, participate in your family life.
Yeah.
Yeah. But it can take a full year to kind of come back around. And then for some people, it's more than that if they've been sick for a longer period of time. And there's a lot of layers to work on too.
Yeah, I have some patients with chronic Lyme, and it's been a long journey. That's for sure. It's not. It can be I don't know, a laborious one, I guess is a way, but so it's good to have somebody so knowledgeable. What about, I know that your passion is so deep for herbs, and I was wondering if you could talk a little bit about, maybe just your top 5. I know you mentioned some for Lyme specifically, but maybe about what you just kind of mentioned there, more like in a broader space, as like you were mentioning about like something calming for the nervous system, something great for the immune system, something great for the gut. And something for the inflammation. That's a lot of stuff, but but I think some of our listeners would love to hear, like, that aspect, things that they can use on their own if they need to go out and get things. And also, what do you think about, is there some herbs that people can grow in their backyard? Because, I know we're moving into a different space and time right now where more people have time at home. And I'm always like you, I think, teaching patients, docere, doctor's teacher, like, what can you grow in your backyard, use in your backyard, make your own medicine? So I'd love your input on that.
Yeah, definitely. I would say, well, luckily with herbs, there's, things work in many different systems at the same time. So
they're multifaceted.
Yeah. I guess and what I'll say too about the herbs is that, like, some folks with Lyme can do well with herbs and some people don't. So if you don't, it's okay. There's other things you can do too.
Right. Don't feel worried.
Yeah. And sometimes when you're in that later stage, where there's a lot of like adrenal fatigue or just there can be a lot of reactivity sometimes for herbs and supplements. And so sometimes you just have to play around and see what works.
Yeah.
And so I was like, the first thing I thought when you were asking about that was chamomile, and chamomile is really easy to grow, also just like easy and accessible to get as a tea. I usually prefer like a whole tea versus a tea bag.
Right.
If you're just really exhausted and that's all you can do, though, it's a good place to start with would be like traditional medicinal tea bags that are a good quality tea. But getting a loose tea and getting a tea ball is a good way to start, or a teapot. So chamomile is really great because you can grow it really easily. It's something that is anti-inflammatory, and it is really helpful for a lot of joint pains. And it's also something that's really healing and soothing for the gut and the nervous system.
Yeah.
So that would be perfect for somebody that's, not sleeping really well, and somebody who has some joint pains. It is, it's more, and it works really well, I think, for people that are a little bit more sensitive. If you're having like extreme insomnia and extreme pain, you might need something stronger than that because it's a little bit mild. But
it's gentle and it's medicine.
Yeah. That's one that came to mind. And another one that could just be growing in your backyard, talking about like using the wild plants and not using pesticides would be, dandelion or burdock.
Oh yeah. So good.
Yeah. And dandelion, you can use all the different plants. You can use all the different parts of the plant. You can start eating the bitter greens in the springtime when they first come up. And those are diuretics, which means they help you if you have a lot of bloating or it's a lot of like swelling. They can kind of like help release a lot of the water in the body.
Yeah.
A lot of minerals in them, which is really important when you have chronic illness. May not be detoxifying properly. So,
constipated or something like that.
Yeah. And then the root is really helpful for like liver health and liver congestion and just nice gentle detoxification. Either with the leaves, you can just eat them right away or put them in your salad green.
Yeah, or soup.
Yep, or soup. And then the root, you can chop it up and dry it and make it into a tea.
Yeah.
Yeah. You can make it into a tincture or vinegar as well.
Oh yeah, vinegar is good.
Yeah, vinegars are nice ways to process herbs if because a lot of times people get stuck on being on lots and lots and lots of tinctures, and then
right,
inflammatory in and of itself. And so it's good to steep things in vinegar.
Right.
And it actually helps to bring out the minerals.
Yeah, especially with the dandelion and nettles too, right?
Yep. Yep. Yeah. So dandelion, burdock, and then I think let's see some other things. Hawthorn berry comes to mind.
Yeah.
And I mean, another big herb I use is which you could also grow in your garden, is Chinese skullcap. We use that a lot with with a lot of the Lyme and the co-infections.
Yeah, skullcap's really good.
Yeah. And so like American skullcap, they have similar benefits, but the Chinese one is just the one that's more well researched in terms of some of the co-infections. And we know that it actually helps when you're using doxycycline for it actually helps it work better. And it's really helpful for the liver, helps protect the liver, which is just really important when you're on antibiotics for a while. And it's also just like a really good thing that's sort of also calming and holding for the nervous system. So
yeah, it's a good nervine, right? And helping the nervous system. So good.
Yeah. And then the hawthorn berries, it's another thing that you can grow, depending on the size of your yard. You could put in a hawthorn tree because they're not that big.
Could. Yeah. That would be delicious. I should try to do that. I don't know if they like our climate though here. I'm not sure. I have to research that.
I would think so. But
yeah, we have more plants here than the rainforest. Just our winters are a little tough, so we have to bring them indoors. But maybe that should be my next plant on the farm.
Yeah, but hawthorn is really nice because it has a lot of nutrients in it, so it can be helpful just as a general anti-inflammatory. But then it's also got a lot of good medicine in there for heart health. It can be used in other formulas for like decreasing blood pressure, and it can help with any heart arrhythmias where your heart's just the rhythm of the heart is off.
Yeah.
And it's a really good common herb that you can easily put into teas, or you could make a vinegar with again. And of course, if you do have like serious heart conditions, you should check with your doctor first. Not skip your medications, but
yes. Which is always good. To check with your doctor first. Okay, great. I think one more. That's 4.
Okay. Let's see.
What about something? Well, you said chamomile for the gut, and you said something for nervous system. Yeah, maybe that's good. I think you're well rounded. Okay. What about for inflammation and pain?
Yeah, I mean, inflammation and pain, I would say like hemp, CBD, turmeric, chamomile are kind of my go-tos for that.
Those are great ones.
Turmeric, I know around here there's actually a farm that grows fresh ginger and turmeric. So we get that. We're able to get
fresh turmeric is the best.
And I have a lot of my patients make golden milk, which you can make with, which is just a really nice, soothing anti-inflammatory drink that you can do before bed. It's relaxing, and it has a lot of the anti-inflammatory properties of the turmeric in there, and you can put ginger and black pepper, and then it can be any kind of milk. And usually with a lot of my patients are not doing very many sweeteners, so just having it kind of plain or with maybe a little teeny bit of honey.
Yeah, something lightly sweetened. Yeah,
exactly.
Yeah. Oh, golden milk is so good. I love that. It's a great little evening tonic right before bed. It's so soothing with that warmth and all those herbs. That's a great one.
Yeah.
Okay, let's see how we're doing here. Okay, so let's talk about Lyme prevention.
Okay.
So we, we went around the whole gamut now. So let's say I'm out hiking, and what should I be like looking out for? Are there some things I can do like before I go hiking, preparation, clothing, any, you know, homeopathics I could take ahead of time? What do you, and then also, and tools, we didn't talk about like how to get the tick out.
Yeah, sure.
Yeah.
Yeah. Yeah. I usually always recommend carrying a tweezer in your first aid kit.
Mm-hmm.
And, you know, if you're going hiking, or putting in your car at least, so you can remove the tick right away. Yeah. You don't want to like light the tick on fire, like any of those sort of like
Right. That's old school. Don't do that.
old school things. You might, yeah, light it. You don't want to put like Vaseline on it or light it on fire. There is a thing called a tick spoon, which some people like to use a little bit more easily, just like pull it out.
Mm-hmm.
But I just am used to the tweezers, and you do want to get as much of it out as possible.
Mm-hmm.
You can always go to urgent. Well, I don't know. Right now, where I live, some of the urgent cares are open, so it could be that where you live, the urgent care is open. If you don't feel comfortable removing it yourself, you can always go to urgent care, but you don't want to like go somewhere where you have to wait around for a long time to get it taken out. Like you really want to remove it as soon as possible.
Yeah.
Yeah, and just like you want to remove it, take as much out as you can, and often, you know, if it's in there longer, it's harder to get it out.
Right.
So that's why you could always seek help if you can't get it all
Ask
out.
a buddy to help you.
Yes, exactly. Yeah.
Yeah, your tick buddy.
Yes. Yeah, but there is a lot that we can do for prevention, which is really exciting. I usually suggest wearing light colored clothing because it's just easier to spot them. And then, you know, if you are going out and it's not super hot, you know, trying as much as possible to like wear long socks and you know, long pants, and then tuck your socks into your pants and tuck your shirt into your pants. And then I usually suggest using there's a couple of things I suggest using. You can use an essential oil, and a roll-on or spray, usually like things like cedar, geranium, eucalyptus, and lemongrass are kind of. There's another one, I think wormwood maybe also, that is shown to be effective. You know, with the essential oils, like none of this stuff is foolproof, but it does all help. And you know, putting it along your neckline and along if you are wearing shorts, putting on your ankles.
That's great.
Can be really helpful. And you know, around here where we live, there's a lot of ticks out just all the time, and so we actually spray our clothes with permethrin spray, which is a insecticide, but the cool thing about it is that it's I don't know if it's not necessarily less toxic than using DEET, but you're not spraying on your skin, so you're just literally spraying on your clothes maybe like 2 or 3 times a year, and you just let it dry out for 2 hours, and then your clothes are good to go through many washes. And you can even get like permethrin lined clothing available.
Oh, interesting.
But it's definitely cheaper to just get the spray.
Right.
And it is an insecticide, so you want to make sure not to like spray it in your garden and you know, kill
on
all
your
your
skin.
pollinators. I usually say like wear gloves and a mask, and don't do it on a windy day.
Right, that'd be bad.
So yeah, everybody has different kind of philosophies around that, but where we live, it's like one of those things that I feel like it's a good thing to do. And if you're going out a lot, like if you're going out on the AT a lot, you know, I have I have so many stories of when I do different talks, you know, in the area, of people saying like, oh yeah, like every time I go on the trail, I get sick, you know. So if you are doing backpacking, going out a lot, where you can't always like take off your clothes very, you know, change your clothes very easily.
Right. If you only have one set of clothes.
Something to think about. But then, another thing that we talked about before was doing a tick check.
Right.
And so where, you know, if you do live in the country, or like you have a dog or something, you know, pet like that, and you're finding a lot of ticks on you, you're just noticing them around, you know, even because when you treat your pet, they're not getting bit, but then they're bringing all the ticks into the house.
Right.
So
you don't want them in your house environment.
Right.
Not a good sleeping buddy.
Yeah. So it's good to do a tick check. Like even, you know, I do this time of year in the springtime, I'll do a tick check twice a day.
Yeah.
You know, and just remembering like, look, either if you don't live with someone, you know, like look behind your ears, use a mirror, look behind your neck. They really like the warm, dark places, so like groin and, you know,
armpits. Yeah.
Yeah. And even like pubic area, like people kind of forget about that, but
right. Don't forget to check the nether regions.
Yes. Right.
Not a good place to have to remove a tick.
No. Yeah. And if you have any trouble, like I had this patient the other day who tried to, you know, take a tick that was like really in there and he couldn't get it all out. And then, you know, then his partner had to help him out, but you know, always get help if you need it. So
yeah. And some people have a hard time, you know, removing something from themselves. Like just the whole procedure of watching, you know, just all of it. I myself don't like to remove them because it's just, we're like,
yeah,
you know?
exactly.
So sometimes it's easier to like stick your arm out to your partner. Can you just take it off?
Right, exactly.
Or if it's on your back, you won't see it.
Right. And another thing too is if you're not familiar with what they look like, you know, I know on the mass.gov public health, if you look for like, you know, what ticks actually look like, they have these cards that show you all the different like stages and the different types of ticks. And so if you're not familiar, it's always good to look that up too.
Some late night reading sounds fun. Maybe like flashcards.
Right.
Around the game while you're quarantined at home around the table.
Right. Exactly.
Yeah. What stage of life is this tick? No, that's great. And okay, so sounds like the clothing. Is there any kind of prevention that people should bring with them, like a remedy that they could take if they were out on the trail and they like, oh my gosh, I've been bitten and I want to take something right now. Dr. Eisenheim said I could take this.
So there's a couple of herbs that I have my patients take often preventatively, just on a regular basis. Like if you are someone, again, that like maybe it's getting a lot of exposure from having a pet or just going out and hiking a lot, or you know, you're a gardener or something like that.
Right.
And you live in an area where there are a lot of ticks that carry the Lyme and the co-infections. I usually suggest, and you don't have to do all of these, and it's good to rotate things so your body doesn't get used to it. But there's one herb called Astragalus membrosus, which is a Chinese herb, Hong Qi, and that is a really strong antibacterial and an antiviral, so it's a good thing to take right now anyways. And I usually just have people do like a dropper full of that every day, and that kind of helps more just for preventing.
Nice, great.
You don't necessarily want to keep taking it for long term. I do have it as part of my acute formula because it helps to really activate some of the immune system for Lyme specifically. So that's a good herb to have around. You can also do capsules, or you can put the astragalus. You can get these like long tongue depressor things, and you can just put them into like soups or stews that you're making.
Oh yeah, those are cool. I like those.
Like for kids, you know, if you don't want. And you can do glycerin with children.
Right.
And another herb that's good to just be taking on a regular basis, again, like maybe a dropper full or a capsule of it every day, is Japanese knotweed. And it's just a super power anti-inflammatory. We know it's very specific for healing from Lyme disease. It can be helpful for preventing it. And the idea is that if you already have some of the medicine in your bloodstream, it's less likely to have like a full-blown attack. And then you have that herb around, so you can increase and you can take more of it.
So it's good to have like a little Lyme first aid kit on hand. Especially if you live somewhere where you have a lot of ticks. We have them here. I mean, I have several patients with Lyme disease here in Asheville, and we have ticks here. They're just starting to get excited and be out in the environment because it's a little bit warmer. Well, that's great. Oh my gosh, we learned so much about Lyme disease today. What's a great way for people to, if they have Lyme or have more questions about Lyme, how should they get in touch with you? Your website, is that the best way to book an appointment?
The website. So the business is Cedar Rose Naturopathic, and then the website is Cedar, like a cedar tree, rose like a rose petal, heals, HEALS.com. And there's a contact form on there. If you want to email me, you can book a free 15-minute consult, a discovery session on there as well. If you're, want to learn more about how I might be able to help you. And there is also a section under services this is Lyme disease, and it has my visual that you were mentioning with the 9 steps, and it has has a short webinar on there as well.
Oh, nice. Great. That's awesome. So people can go to that and learn some more. And then also your Facebook page, where I know you have great events that you, I mean, you probably don't have anything right today because of the different place you're in, but you're going to have some things coming up, I would think.
Yeah. Yeah. I've been doing a lot of herbal workshops. I've been trying to transition to doing like online workshops and webinars. So that might be coming down the line as well.
Yeah. Okay. So they can follow you on Facebook at Cedar Rose Naturopathic to keep in line with the events you have coming up. And then also Instagram, the Cedar Rose Naturopathic as well.
Yeah.
Great. Okay. Thank you so much. And, you know, I see a great Lyme ebook in your future. So maybe think about that, because that'd be a fun way for people to, super educational to download, and they can have all this great information and tips.
Yeah.
Well, thanks, Dr. Eisenheim. It's been so great to have you on the show.
Yeah. Thank you. It's been great to be here.